Good afternoon, and thank you all for coming. As Minister of Seniors, Wellness and Social Development, health promotion and healthy living is an important part of the mandate given to me by the Premier. And I believe that measures that help to prevent and reduce the prevalence of smoking throughout our population is certainly a step toward a healthier Newfoundland and Labrador. We all know the dangers of smoking and secondhand smoke. Successive governments have taken a comprehensive approach to reduce smoking over the years. And as society evolves and attitudes have changed, our legislation and regulations around smoking have changed. Since the introduction of the Smoke-Free Environment Act and the Tobacco Control Act in 1994 that prohibits smoking in indoor public places and workplaces and prohibits the sale of tobacco to persons under the age of 19, several other key actions have been undertaken. Smoking has been banned in bars, including patios and decks and bingo halls. Restrictions have been placed on how tobacco products can be displayed, stored, and promoted at retail. Smoking has been banned in motor vehicles with persons under the age of 16 are present. Designated smoking rooms have been removed from workplaces. These efforts have seen positive results. Overall, smoking rates have decreased in Newfoundland and Labrador from over 28% in 19 and 99 to just under 20% in 2013. The news is better for those aged 15 to 19. Smoking is down from 30% to 12.4%. For young adults aged 20 to 24, it is down from 37% to 28%. While much has been done in the last 20 years to restrict smoking in public places and to discourage young people from taking up smoking, we can't let down our guard. We are concerned about public health, particularly of children and youth, resulting from the availability of flavoured tobacco and hookah products and the potential harms of electronic cigarettes. For that reason, we are introducing amendments today to mark the next step in the evolution of our efforts to prevent and reduce the prevalence of smoking in our province. Proposed amendments to the Smoke-Free Environment Act 2005 and the Tobacco Control Act will strengthen measures to protect people from the harms of flavoured tobacco products and hookah smoking and the potential harms of e-cigarettes. These amendments will prohibit the sale of flavoured tobacco products, including menthol. The ban will apply to cigarettes, cigarillas, fine-cut tobacco, and smokeless tobacco that have a characterizing flavor such as candy, bubblegum, fruit, menthol, or are represented as being flavors. With respect to e-cigarettes, proposed amendments will prohibit the sale of electronic cigarettes to persons under the age of 19, prohibit the sale where the sale of tobacco products is currently prohibited, prohibit use in indoor public places, workplaces, and in motor vehicles when occupied by a person under the age of 16. Restrict the promotion, including advertising and display of e-cigarettes in the same manner that the province currently regulates tobacco promotion and display. Our amendments related to e-cigarettes aim to strike a balance between minimizing potential health risks for these products while recognizing that some individuals seek to use these products to quit smoking. With respect to hookah, proposed amendments will prohibit the sale of non-tobacco shisha products to persons under the age of 19, prohibit the sale where the sale of tobacco products are currently prohibited, restrict the promotion, including advertising and display, in the same manner that the province currently regulates tobacco promotion and display, and prohibit hookah smoking of non-tobacco shisha products in indoor public places and workplaces, including any existing hookah establishment. The following changes will come into force upon the amendments receiving royal assent. Prohibition of the sale of e-cigarettes and non-tobacco shisha to persons under the age of 19. Prohibition on persons under the age of 19 from entering or working in a hookah establishment. and prohibition on the use of e-cigarettes in indoor public places, workplaces, and in motor vehicles when occupied by a person under the age of 16. All other changes will come into force on July 1st, 2017. We have delayed the implementation date for several of the amendments in recognition that businesses will need to adjust to the new legislation. The changes we are making to our legislation are closely aligned with several other jurisdictions in Canada, including the other Atlantic provinces. We will be joining with Nova Scotia, New Brunswick, Alberta, Quebec, and Ontario in banning flavoured tobacco, including menthol. Our amendments respecting e-cigarettes will make our legislation similar to that of 7 other provinces, including the Atlantic provinces, Quebec, Ontario, Manitoba, and British Columbia. And in 2015, the other Atlantic provinces banned the use of hookah water pipe use in indoor public places. In recent years, several Canadian municipalities, including the cities of Toronto and Vancouver, have implemented similar bans. In proposing these amendments, we are joining with others in trying to prevent and reduce smoking and promote public health in our society. In addition to strengthening legislation, the provincial government supports other initiatives aimed at supporting individuals to quit smoking, such as the Provincial Smoking Cessation Program for individuals with low income and the Newfoundland and Labrador Smokers Helpline. I have spoken to what we are changing here this afternoon. Now I will turn things over to Minister Haggie, who as Minister of Health and Community Services and as a former surgeon is very well positioned to speak to the why surrounding these amendments. Minister Haggie.
Thank you, Minister. I'm pleased to join my colleague, the Minister of Seniors, Wellness and Social Development, here today as we outline changes to legislation that will advance our government's commitment to protect public health. As the Minister has stated, the changes introduced today will regulate flavoured tobacco, electronic cigarettes and hookah smoking. Our key objectives with these amendments are to prevent the uptake of smoking by children and youth, to prevent exposure to harms from second-hand smoke and the potential harms of vapour, and finally, to reduce smoking prevalence. I believe these amendments to our legislation are the appropriate next steps in our efforts to improve population health. These issues have been a priority in many other provinces of Canada, and our initiative is consistent with what is going on elsewhere. Combined with our existing regulatory environment for tobacco products, these measures will result in improvements to our health and, over the long term, reduce the costs of providing health care. I don't think I need to go into an exhaustive list of the harmful effects of smoking. These have been well documented for decades. There are direct effects of smoking tobacco, which contains tars and chemicals, which in turn increase the risk of cancer. Non-tobacco products can still produce tars and chemicals, which over time can lead to the development of cancer. There are many more negative effects of smoking outside of cancer, such as heart and lung disease, and of course, nicotine alone is very addictive. If we want to have a smoke-free society, we must stop people from beginning to smoke in the first place. This, of course, is critically important for our children and youth. Flavours such as menthol, mint, candy or fruit added to tobacco products make them less harsh and more attractive to young people. They're often packaged in brightly coloured, scented packaging, again, appealing to young people and increasing the possibility that they will experiment with the product. For these reasons, we're concerned about them serving as the gateway to tobacco addiction for youth. With respect to menthol, research shows that menthol cigarette smoking is how many young people are introduced to smoking, and that menthol cigarette smokers find it harder to quit. In Newfoundland and Labrador, just over 4% of adults use menthol. However, the 2012-13 youth smoking survey shows that for youth tobacco users in grades 9 to 12, a full 53% of them use flavoured tobacco in the previous 30 days, with 36% of them having smoked menthol cigarettes in the last 30 days. E-cigarettes hold the potential to introduce the smoking culture to young people who wrongly assume there are no negative health effects. Vaping, e-cigarettes look a lot like smoking and serve to normalise smoking behaviours. That's something we've worked very hard to stop over many years. As there is no regulation and no substantive research as to the long-term health effects of vapour products, we really do not know what people are inhaling when using e-cigarettes. Having said that, we recognise that adults may wish to use the product to help them quit smoking traditional cigarettes. For that reason, we're not prohibiting e-cigarette products, but are regulating them in a similar way to the way we regulate tobacco. This will help minimise their accessibility to children and to youth. And finally, hookah is simply another form of smoking. Studies show that smoke from tobacco and non-tobacco preparations contain carbon monoxide and other toxic agents known to increase the risks of smoking-related cancers, heart disease, and lung disease. Second-hand tobacco smoke from hookahs is also a risk for non-smokers. Therefore, it's time to address this issue, as many other jurisdictions have, and ban the smoking of all shisha products from all indoor public places and workplaces. It's a public health issue, and we feel we must take action to protect the public and employees who work in such establishments. On the whole, we're hopeful that the legislative amendments we're putting forward today will serve to better protect people from the harms of flavoured tobacco products and hookah smoking and the potential harms of e-cigarettes. As Minister Gambin Walsh has already noted, the changes we're proposing will bring our legislation in line with several other jurisdictions around the country. I would emphasise, though, that these amendments are not only in line with other provinces and municipalities, they are evidence-based and in keeping with research and recommendations from recognised sources in Canada and around the world, including the Canadian Tobacco, Alcohol and Drug Survey, the World Health Organization, the US Centre for Diseases Control. I, along with Minister Gambin Walsh, look forward to the debate on this legislation, which we believe will serve the interest of advancing public health throughout Newfoundland and Labrador.